Hello, my name is Shamin Chambisha, and this is a presentation about health promotion. So being healthy can mean different things to different people, thus the different perspectives on health. However, the most common description is absence of injury or disease. The World Health Organization defines health as a state of physical, mental, or social well-being rather than mere absence of disease. Therefore, health is not determined by a single factor, but a number of factors. Just like in this diagram. So these determinants positively or negatively impact on health. So this is where health promotion comes in to raise awareness of the health risks associated with the negative impacts, as well as educate people on making health life choices through initiatives such as promoting vaccination or running health campaigns. What is health promotion? Health promotion is a public health approach aimed at encouraging people to live fitter, healthier, and more active lives while avoiding health hazards. So this approach aims at improving health among individuals, communities, and populations. The main focus areas of health population are mental health and well-being, diet, obesity and physical exercise, smoking, alcohol and drugs, HIV and sexual health. So information is delivered through health education, and individuals can freely decide on making positive health changes. So examples of health promotion campaigns, I chose Better Health campaigns, for example, the Better Health, Healthier Families, and Better Health, Every Mind Matters. The Better Health, Healthier Families. So the Better Health, Healthier Families, this campaign was previously named the Change for Life. So as Change for Life, it was launched in 2009 at the time when childhood obesity was reaching extremely worrying levels, and it was originally designed as part of the Childhood Obesity Prevention Plan. It was introduced as a fun and interactive way to get the whole family to make health life choices. The purpose of this campaign was split into 4 stages: alert, motivate, support, and sustain. So this involved raising awareness of the dangers of consuming excess sugars, providing healthier alternatives through apps and other Change for Life programs, as well as encouraging parents to control children's diets. The campaign also encouraged healthy habits such as consuming 5 portions of fruit and vegetables a day, as well as leading a healthy lifestyle. The Change for Life witnessed resounding successes, such as exceeding its first-year targets, noticeably huge impacts on families, as well as increased support from partners, among other achievements. So, becoming part of the Better Health contributes to a full range of activities, including NHS tips, tools, and apps. Therefore, families have essential support to make health life choices. The Better Health, Every Mind Matters. So the Every Mind Matters campaign was launched in 2019 at the time when half of the adults in England attributed the pandemic's negative effects to their mental health. The campaign aims at improving individuals' mental health by encouraging people to take a short quiz to get a tailored mind plan with personalized tips to help individuals deal with anxiety and stress, boost their mood, sleep better, and feel better. The campaign provides mental well-being support through providing information and videos to the young people, as well as a dedicated website to help parents and guardians to take care of children's mental well-being. During the pandemic, 247 crisis lines were created across the country. Mental health support teams were allocated in schools, and ads like "What Works for Me" suggested ways of being active to keep a healthy mind. Over 3.4 million mind plans have been created since 2019. So the models of health promotion. Health promotion activities are supported by a number of theories or models to help better understand health behaviors and guide through treatment processes. These models are chosen based on the health problem, the population, and the current circumstances. Examples of models of health promotion are the health belief model and the stages of change model. The health belief model is a theoretical framework that describes and predicts the evolution of health-related behaviors. It is comprised of 6 factors. Perceived susceptibility implies that behavior change results from the perception of associated health risks. Perceived severity implies that behavior change results from the intensity of perceived consequences. Perceived benefits implies that behavior change results from the convincing positive benefits. Perceived barriers refers to the negative aspects associated with behavior change. For example, thinking it is expensive or difficult, which may lead to persistence in old behavior. The cues to action. These are powerful triggers that motivate action to behavior change. Self-efficacy refers to the confidence in ability to accomplish a health-related behavior. The stages of change. Okay. So the stages of change model, this is also known as the theoretical model. It was created by James Prochaska and Carlo Di Clemente in the 1980s. It describes a person's readiness to change and defines behavior as a series of small steps that lead to permanent changes. The stages include the pre-contemplation stage. At the pre-contemplation stage, individuals do not acknowledge they have a problem, and therefore they have no intentions of change. The contemplation stage is when individuals acknowledge they have a problem but are unsure about the readiness for change. At the preparation stage, individuals are getting ready for change and may get information from families, friends, and healthcare experts. At the action stage, individuals have started making changes and may start with small goals, which may progress to long-term goals. At the maintenance stage, altered behavior is maintained with efforts to avoid temptation. At the relapse stage, this involves a common occurrence of susceptibility to revert to old habits. However, there is an option of restarting so as to achieve desired behavior. Comparisons between the health belief model and the stages of change model. The health belief model focuses on individuals' attitudes and motivations towards behavior change. For example, perceptions of the behavior's effectiveness can lead to behavior change. Therefore, addressing ways of improving perception knowledge can motivate behavior changes. The stages of change model, on the other hand, focuses on integrating new behaviors, goals, or programs to promote health choices. It depends on the individual's readiness to embark on the stages of changing a behavior. It involves levels of progression to the next stage and regression to the previous stage until desired behavior is achieved. So the effectiveness of the HBM and the stages of change model. So HBM has been used in patients with a variety of diseases. It has also been used to create behavior change interventions, and several reviews have documented HBM's performance for predicting behavior. The stages of change model, through its different stages and strategies, practitioners can make individually tailored interventions which are likely to be successful than the one-size-fits-all interventions. It can also be used in health promotion programs, for example, tobacco use, weight management, and addiction. So, although both models can be used to target a variety of health behaviors, there is insufficient evidence to their effectiveness. The use of the HBM as a theoretical basis for adherence-enhancing interventions has been questioned after research to identify studies that use HBM showed that their intervention success was unrelated to the HBM. In regards to the stages of change model, a recent meta-analysis of randomized controlled trials found that the TTM's intervention effectiveness at improving physical activity accounted to constructs such as self-efficacy and not the different stages of change. So both models seem to take the effectiveness credit at the expense of other health promotion activities and approaches. However, whichever model is used to better understand health promotion and how it is done, the main goal is to assist individuals in improving their mental health and well-being. So, my health promotion campaign. So the campaign I've chosen is Quit Smoking, Choose Life campaign. The reasons for choosing this campaign is because smoking is the leading cause of preventable diseases and deaths. Most smoking-related deaths arise from diseases such as lung cancer and chronic obstructive pulmonary disease. So, by quitting smoking, there is reduced risk of cancer as tobacco smoke contains 7,000 chemicals and 69 carcinogens, which are chemicals that cause cancer. Also, there are immediate health benefits, even when someone already has health problems. There is also reduced risk of secondhand smoking. So my campaign is intended to raise awareness of the health risks associated with smoking, as well as educate and support people through their quitting journey. The rationale for Quit Smoking, Choose Life campaign is based on the stages of change model. So, at the pre-contemplation stage, when participants would be unwilling to quit smoking and may dismiss my campaign advice, my campaign team will raise their consciousness, for example, by encouraging them to seek new information. And also it will encourage environmental re-evaluation for them to assess the physical and social effects of smoking. So at the contemplation stage, when participants would still be smoking but willing to quit in the near future, my campaign team will raise their awareness and encourage environmental re-evaluation like the previous stages, as well as encourage self-re-evaluation to think about their feelings when they have a smoking-related illness. At the preparation stage, when participants would still be smoking but may have started making adjustments for quitting, my campaign team will encourage self-re-evaluation like the previous stage, self-liberation to believe in changes, ability and commitment, self-conditioning to choose healthier alternatives in situations such as anxiety, and stimulus control to find cues that remind them of positive behavior. At the action stage, when participants may have begun the quitting journey and may have high relapse risks, my campaign team will encourage self-liberation, counter-conditioning, and stimulus control like the previous stages, as well as contingency management to acknowledge and reward positive behavior. At the maintenance stage, when participants may have quit smoking for some time and may have greater confidence and reduced risks of relapse, my campaign team will encourage counter-conditioning, stimulus control, and contingency management like the previous stages, as well as encourage them to have helping relationships. And this is to encourage participants to take advantage of the support systems such as families, friends, and healthcare providers. So, my campaign team will target adults, youth, pregnant women, and lactating mothers. And my promotion strategies are television ads, radio ads, posters and flyers, online advertising through social media, local community events, as well as partnering with schools. So the resources I'll use, I'll create a website for easy interactions, healthcare professionals for health advice, education materials in different languages to target risk groups, as well as motivation messages from ex-smokers. I'll also use apps such as the I Can Quit app to help them in their quitting journey. I'll also provide additional support, for example, free nicotine medication, easy access to nicotine replacement therapy, as well as quit plans which will contain medical advice from healthcare professionals. So determining my campaign's effectiveness. Okay. Before the launch of my campaign, I will have an evaluation plan already in place that will include campaign goals, objectives, available data, and campaign resources. It will be referred to every month to identify the successes, areas of successes, and areas of improvements. I plan to launch my campaign on the World No Tobacco Day on the 31st of May, and it will run for a full year. However, its progression will depend on its success. The effectiveness of the Quit Smoking Choose Life campaign will be determined by collecting data before, during, and after program implementation. So, for example, outcome metrics. This may involve health metrics, behavior metrics, and economic metrics. These are used to assess the effectiveness of health initiatives, track adherence to health programs, or evaluate cost effectiveness. Qualitative assessment. This involves stakeholders' perspectives, case studies, or behavioral instincts. So qualitative assessment is crucial in exploring the depth and complexity of individuals' experiences. Process evaluation. This involves implementation fidelity, reach, and engagement, as well as contextual factors. Process evaluation helps in identifying barriers as well as and facilitators, enhancing program quality, and guiding continuous improvement efforts. Long-term and short-term impacts. This involves immediate versus sustained changes, as well as behavior maintenance. This is essential for recognizing achievements alongside strategies for lasting health behaviors and encouraging continued health practices among participants after the campaign ends. Data sources and technology. This involves integrating health promotion information into electronic health resources, for example, the EHR, or analyzing large data sets. This allows seamless data tracking, reducing data implementation errors, and improving program efficiencies. Ethical considerations. This is a values-based approach in efforts to enhance program health, to enhance better health programs. Community or digital audience feedback. Gathered individuals' opinions about the campaign will be used to learn and grow to enhance the campaign's effectiveness and sustainability. However, responsive feedback requires commitment from all parties, including decision makers, researchers, implementers, and stakeholders. So although the evaluation process is essential for assessing the program's effectiveness and impacts, there are several changes and limitations. Operational inefficiencies and inequities result from issues like data quality, limited resources, timing, or program complexities, which affect the evaluation outcomes. And by focusing on the strengths rather than the weak areas of the evaluation process, I'll ensure whether collected data aligns with the evaluation objectives and answers evaluation research questions, and the overall campaign performance from the evaluation outcomes will determine its progression to the next year. So this is the end of my presentation. Thank you for watching.